Hello, and welcome to the next session. So, today we're going to talk about something that I think is really important, which is how to speak in public. You're learning a lot of stuff in this internship, and some of you will apply that to writing op-eds and such, but some of you will also hopefully be speaking back with your classes where you came from, and you'll be giving public presentations to communities and to medical groups. And so I'm really glad that the internship includes a chunk of time to kind of think about how to develop your skills at public speaking. So let me show you some slides about that. So um, you can see those, yes? Good. So the run of show is you'll hear me blathering on for a bit about the content, about ideas about how to speak. We'll talk about how to structure a presentation. We'll talk about how to arrange the room when you're speaking if it's in person. We'll talk about some tips for actually speaking, how to get better at actually speaking, where to speak, when to speak, and then we'll pause and we'll do some breakout groups where you will have a chance to practice a little bit, build a 1 minute elevator speech, so to speak, in small group. Then we'll come back and we will each of the groups, I think we'll probably do 3 groups, will demonstrate your ability at that. And then I have about another 10, 15 minutes of stuff I wanted to talk about with you after that. So that's kind of the run of show. Is that what you were expecting? Please say yes. Good. Okay. Because I could talk about lots of other things, but that was what I was expecting. So good. Okay. So kind of one of my first reasons to think about this was in med school. I was in this class that could have looked like this. And I'll bet y'all have been in those classes. It was more embarrassing when all classes were in person. In Zoom, you can turn off your camera, I guess, but it was, classes actually often sometimes looked like this. And so there was me. I was awake at the moment. It was a neuroanatomy lecture, and I swear to God, this happened. The instructor pointed and said, "You there, wake up the guy next to you who's sleeping." Um, I wish I had the presence of mind to say this, but I didn't. I just, but what I should have said was, no, no, no. It's your job to keep us awake. I didn't say that, but that's really true. It's your job to keep the audience engaged. If you see a room doing this, um, it's not their failure, it's your failure. So here's some things I've actually heard people say at the beginning of a presentation, and I would urge you to never say these things. If you find yourself inclined to say one of these things, um, stop, take a breath, and rethink what you're saying. Don't introduce with "I'm sorry." No, no, I don't want that. There's too much material, and this is a common thing for people to say. I've got like way too much to talk about, and so I'm going to speak really, really quickly, and you get ready to keep up and fasten your seatbelt. No, the way to get through too much material is to not have too much material. And the way to do that is to do something I learned from watching Project Runway back when it was good, in which is people who are new to dress design. Guilty pleasure. I love Project Runway. People who are new to Project Runway, new contestants, would sometimes put like a million creative ideas into one dress. Um, and that dress was an abomination. And so the most common feedback, in my observation of watching the show, the most common feedback from experienced judges to contestants was, "You've got too many good ideas here. There's going to be more dresses. Take some of this out, simplify, have less material." So if you have too much material for your presentation, that's shame on you. Take it out. Remove chapters. If you feel like you need to go into the depth that you're going, then figure out which chapter of material you don't need to talk about in that case. Don't do this. And I've seen people literally do this. People say, I was asked to talk about this. I'm much more interested in this other thing. And, if you have questions, we'll come to that. Please ask me about that. But we're talking about this because it's my assignment. Don't, no, if you took the assignment to talk about this, then talk about this. Talk about this. If you're not interested, why the heck should the audience be interested? I don't know anything about these slides. As a matter of fact, I just got them about an hour ago, so we're going to walk through this together. This is really Bob's presentation, so we'll see what's in here. No, no. Um, maybe that's true, but then develop the skill at winging it. I mean, don't take somebody else's deck an hour before. Um, feel like you know what you know. It's don't. I don't want to hear that from anybody. Um, and this is one of my particular favorites. I know you can't see this. I know there's like, it's a 3-point font on this slide, so I know you can't really tell this. I know we got like 300 layers of detail on this spreadsheet that I thought you needed to see the whole spreadsheet for. No. Maybe you'll want to show a 300 line spreadsheet just to show that there's a wealth of data. But if you do that, then your only talking point is look at how much data there is. Don't try to have somebody look at, that little line. If you need them to see that little line in there, well, then use your PowerPoint skills and blow that part up so that they can actually read. If you're saying, I know you can't see this on my slide, again, shame on you. It's your problem. Um, Last time I checked, one of the criteria for getting into med school is you have to be an adult. So that includes time management skills. That means get your own watch. If you can't pace yourself, have your own watch. Most laptops have a clock on them. There's a clock in most lecture halls. Get a clock, manage your own time. Figure out where you need to be at which point. If you do find you're running late, if you find that, gee, I'm only a quarter of the way through and I've used a half of the time, it's okay, not perfect, but it's okay to skip a section in the middle if that's the lower priority. So think in advance if you're inclined to run behind. Think in advance what you're going to torpedo out of your talk if feel like you're getting late. And pro tip, torpedo that even before you start. If it's not essential, get rid of it. Save more time for Q&A. So, but don't ask somebody in the audience to watch time for you. That's your job. That's your job. When you start doing those things, I feel like you've taken me like deep into the kitchen, and I feel like I'm just seeing the kids bringing the pots around. I don't want to go in your kitchen. I don't want to do that when I'm watching a presentation. I want dinner. You invite me to a talk. I want a nice, tasty dinner. I want it to smell good. I want it to be, I want it to be good. I want good, healthy food. I want it well prepared. I want it to follow a story arc. I want to, sometimes we like to eat dessert first. I get that. But in general, there needs to be like a flow to the story. And don't make me so stuffed that I'm afraid to drive. Leave me satisfied, but make me think, I want more. Make me think I want more. So the first impressions matter. The smell in the room matters. How you open the talk matters. And I confess, this is one of the areas that for me is aspirational and not completely accomplished. But some people will feel like they need to thank, they need to thank Dr. Keller. They need to thank Dr. They need to thank everybody who, thank your mother, no, maybe thank one host if you really need to, if it's that kind of a setting, but don't spend 30 seconds thanking 25 people who brought you there. Don't do that. Don't start talking about the weather or whatever. Unless there's a reason, don't do small talk at the beginning. It's okay to start by not saying a thing. If you're in the room and you're trying to get their attention, it's okay to just stop. Just stand up, stop, breathe. And we'll talk about breathing a few times and find somebody to make eye contact with. You don't have to like walk up to the mic and immediately start speaking. It's okay to get up there, collect your thoughts, and think for a moment. Actually, that's a way to get people to builds a little bit of dramatic tension. People are thinking, I don't really know what they're going to say. So that's okay to do. A good beginner can be to engage. Here's a use of second person pronouns, and we're going to say more about that. I'll bet you're asking yourself. That's a surprisingly effective gambit. People sometimes aren't asking themselves anything, but if you plant that, then they are. So I'll bet you're asking yourself this, and that helps sort of frame what you're going to be talking about. It's very tempting to have an exhausting work plan or an exhausting agenda. If you notice, I kind of sketched out what we're going to talk about. I usually do that. I try to do that at the start of the talk. But I used to make my slides that had like 6 chapters spelled out with like a bouncing ball showing you where you were on chapter 6. Now we're here. No, if you have a detailed agenda posted that people are literally able to follow along with, when you're about 20 minutes in, they're going to be thinking, oh, crap, he's only 20 minutes in and he's still got 4 more chapters left. When's this going to end? That's why, if you notice, my slides don't have page numbers. My slides don't have page numbers on them because if you're like me, somebody has page numbers, you'll get momentarily bored. You go, really? This has been 26 slides already. You don't want to emphasize that. So an agenda. It's not a work plan. You notice that I try to begin aspirationally with asking, is this what you were expecting me to talk about? And get them to say yes. I one time had them say, no, we thought you were going to talk about Medicaid expansion. I went, shit, that wasn't what I thought I was going to talk about. Um, so then I had them vote, because I had both talks. But every once in a while, you ask that question, and it's embarrassing what the answer is. But getting their permission is a good way to kind of build more engagement. They need to know where you are in your story arc. So I kind of spelled things out to you. I spelled out that there's going to be this thing in the middle, and then there's going to be a little more blathering at the end. So a little bit of managing expectations is good, but not in detail. Don't follow the bouncing ball. Um, you're a performer, like it or not. You're on stage. When you go to a concert, they often will have tuned the piano before they've opened the concert hall. So don't do that. John Bart, I think his name is, put that in one of his books. Don't tune the piano on the stage. When room's full, start playing the song. I'm really not good at this, but it's a really good gambit. Think of your opening line. Plan your opening line. That's the first thing they're gonna hear. So it's a good thing to do. Think about your first few words. And yeah, I mean, I saw somebody just last week who had written a Word document. He'd gotten it published, was asked to speak on it. So he turned that, now a PDF, into line by line PowerPoint slides. It was literally his whole document, which then he read every line to the people in the room. So it was PowerPoint, but no, I can read too. So sometimes, you need to read some of the things. And if you want to be dramatic, sometimes to make a point, you will just stop and read what's on there and say, I'm going to read that. But your audience usually can read. So here's a model I found really useful that I don't know of anybody who's adopted. And this is a model about how we think. So here's a picture of what is not my comfort zone. My wife is very into jewelry making and into bead making, actually. And we occasionally will go into bead shops where she can buy things that are ways that she can supplement and enhance her work. And it's really amazing what's in there. I get within about 15 feet of a bead store and I start getting the hair on my arms start standing up because it's so much detail. It's so much granularity. I can't stand it. I can't stand it. I completely recognize the value, but I can't stand it. And yet I love this. I love a necklace. I love a complicated necklace. So my comfort zone is the story arc and not the granularity. But we all have that. And this guy, Manny Elkind, described what he calls the whole brain model of different comfort zones. And he said that there's four. He said some of us have a comfort zone of facts. And so, the comfort zone of facts would mean all the granular detail, the beads, so to speak. Some of us have our comfort zone of forms, which is the how do we do this? How is it going to be controlled? What's the process? What does it look like? The more structural nature to it. Some of us don't care about any of that unless we know where we're going. If you can't tell me where we're going, why am I interested in the facts or in how we're going to do it? I need to know where we're going. And then some of us don't care about any of that unless there's like a really warm human face on the thing. So we all have all four of these as our comfort zones, but we all have one, maybe two, where we are the most comfortable. And I promise you that we're not the same. I promise you that we are not the same. So think about that. If you're talking to somebody whose comfort zone is forms and you're talking about feelings, they're not going to hear what you're saying. A lot like the stuff we talked about communicating across the chasm. They're not going to be able to hear that. And likewise, if you're a person who likes feelings and you're hearing data, it's not going to get through. So an example of where I blundered on this, and having done so many talks, I've blundered a lot. So an example of where I blundered on this once was I had somebody, I gave my little single payer spiel, and they got up in the back of the room and they said, well, that's all fine, but my uncle, I think his story was, my uncle is from Canada, and he waited so long for his heart surgery that he had a heart attack while he was for he waited so long for it's for his heart surgery that he waited so long and had so much pain that he died from that. Um, Probably not getting that story exactly right. And so I um, I'm not getting that story right anymore. It's been so long. He was waiting for back surgery that he had to wait so long for, and he wound up dying while he was waiting for the back surgery. And so I responded to him by talking to him about waiting list data. So I said, yeah, the waiting list in Canada is like this. The waiting list in the United States is like that. Um, Completely the wrong thing. He presented an anecdote, a story about his family, and so he was in the feelings quadrant, and I responded in my comfort zone, the facts quadrant, and that was the wrong quadrant to respond in. Complete disaster-driven answer. What I should have said was something like, "Oh my God, that's a horrible story. Oh my, that's a horrible story, and nobody should have to go through that." And matter of fact, you're telling me that story reminds me of a story of one of my patients who yada 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 couldn't even get on the waiting list because he didn't have insurance. So my patient's story is horrible. Your uncle's story, that's just a disaster. Nobody should have to go through that. And in fact, here's some facts maybe to unpack it a little bit more. Here's some facts about the Canadian system that maybe context, something. But if somebody tells you something from the feelings quadrant, you need to respond initially, at least, in the feelings quadrant, or vice versa. Somebody tells you we can't afford it, or somebody tells you, they don't tell you an anecdote. They tell you waiting list problems in Canada. Somebody tells you something like that. You can't respond to a data question about the waiting list in Canada with an anecdote about how damaging a waiting list is. You can't do that. You have to respond in their quadrant. And then you can go back to the feelings quadrant if you want to. So think about when somebody's asking you a question or makes a comment to you, um, I'm often in the first 10, 15 seconds, I've kind of figured out where this is going. And I try not to interrupt, which is something that I'm also not good at. I try not to interrupt. But one of the things I do while I'm trying not to interrupt is to analyze where their question comes from, which quadrant, and how I can answer in kind, and then try to do that. So when you're talking to one person, you can do what I just said. You can listen and think through where they are on this and try to respond in kind. When you're talking to a larger group, however, which is today's topic, the point of this quadrant system is to analyze yourself and think about, well, my gosh, my talk is entirely in the facts quadrant, and I'm going to lose anybody from the other three quadrants. So what I try to do when I'm giving a talk to a large group is make my talk or structure my talk and then go back and analyze it. How much how much of the feelings quadrant do I have cooked in there? And I try to, since I don't like hearing people in the feelings quadrant in presentations, it makes me feel like I'm being manipulated. I don't like those anecdotes. It makes me feel like somebody's intentionally doing what I'm about to tell you to do, manipulate. So I know that I seldom put those in unless I force myself to. So when you see me do a talk, I will sometimes have gone back through it and intentionally inserted anecdotes every 10 minutes or so to try to bring in the people from the feelings quadrant, if I have long enough time to be doing. So the point is, look at your own presentation and try to roll around amongst the four quadrants. In single payer, here's just examples of what that means. Facts, we have no shortage of facts. Forms, two useful things that I find always worth mentioning. A lot of folks don't realize, to whom you're speaking, that there are actually active bills in the House and Senate that would accomplish what we're doing. So at some point, mention that. At some point, mention that there is everything I'm telling you about single payer is actually very clearly articulated in a bill that's active in the House and active in the Senate today. For some people, knowing that there's active legislation that could accomplish this, even though it's, I know it's not going to pass in the next 3 years, even though that, knowing that there is a vehicle, a form, a process is transformative from this being what, where are we going to how we're going to get there, really critical. Or another way that sometimes can help people get it is, hey, we got the Social Security Act. Social Security, you get signed up for it when you're born, and they find you magically when you're 65, and start paying you a check, and then you keep it till you're, so you've got this number. They know where you are. So for some audiences, bringing that up and say, all we need to do is say you get your Social Security card when you're born, pretty much, and you get your health insurance card when you're born. Link these two things together. And indeed, as you probably know, Medicare was an amendment to the Social Security Act, so we could do more like that. So process sometimes is really important to mention. Futures, we have no shortage of that, no barriers to care, so think of whatever future vision, what future state you're trying to accomplish for the audience that you're talking to. And feelings, of course, there's plenty of ways to go at this. Your anecdotes, your patient's anecdotes, an anecdote from your family, keep them short and brief, but make them have a point. And then sometimes if you don't have one handy, for one person that I've helped build presentations, he has this really cool story, horrible story about a patient of his that lost their foot because of neglect, because of lack of insurance. And so we popped up actually a graphic of somebody cradling a foot to help sort of, it makes you want to nurture that foot. So think about an image, in addition to your anecdote. So, okay, so think about how you're going to pace your talk. Think about what they're going to remember. So there's this thing that psychologists have told us about called your ability to recall things. And this has been studied. So you can remember stuff from the beginning of a talk and really from the end of a talk, but the stuff in the middle gets kind of obscured. Oops, sorry. So the stuff in the middle gets relatively obscured. So that's a well-established pattern. And I love this from FDR. He said, talking to Frances Perkins, who created the Department of Labor, he said she was nervous about speaking. And he said, don't be nervous, just be sincere, be brief, and be seated, which I thought was pretty good. So this is described as the primacy effect, the ability to sort of remember the beginning more, and the recency effect. And then there's this dead zone in the middle. So it's particularly in the dead zone in the middle that you want to kind of try to take advantage of what I was saying. Pharma spends a lot of money on this stuff, and they know this. So pharma knows to put side effects at the end of the dead zone, the weakest part of the dead zone. So that's where the ads are. If you pay attention to pharma ads, they do all sorts of other intriguing things to make you not remember the negatives. But timing of the ads is, I thought, a pretty interesting thing. So your story arc, you want to open briefly. You want to engage the audience. We talked about a few ways that you might do that. You need to establish your credibility. Why should I be listening to you? And you used to be able to just do that by saying, I'm a doctor. That doesn't work no more. You need to show that you care. Your anecdote, your opener has to in some way show that you care. It doesn't have to be long, 10 seconds, but something that shows that you care, and then your credibility has more importance. So you want to, we talked about this under the crossing the barrier piece. Activate nurturing. You want to try to activate a nurturing part of the 80% of people who have that in their head early in your presentation. Get permission. It's a form of engagement. Then you want to go to the problem statement in general. So that's one thing we can learn about that is from Shark Week. So a friend of mine used to work at National Geographic when they first came out with Shark Week. And, it was the first time they did it, or Discovery Channel, I guess. No, it was Nat Geo at the time. So he was working there, and he said the day after they did their first Shark Week thing, their CEO came in to the room and said the more ferocious the predator, the higher the ratings. So Shark Week is the thing that created this notion. Hence, we see all kinds of horrible predator stuff, in media. But that's true. The more ferocious your predator, so I consider that the predator part of the presentation. We call it a problem statement, but that's the predator. Establish your predator. We talked a little bit about that before too. Your problem statement cannot have 30 problems in it. No matter how long your presentation is, 3 messages at the most. You want to roll around the quadrants if you can in that. Your solution. Martin Luther King, we all remember when he said, I have a dream. I have a dream. Decades later, I have a dream still lands and resonates. Elizabeth Warren's I have a plan for that. Sounded really clever and great. And oh my God, that landed on me because I loved that. I have a plan, but most people know I have a plan for that. It sounded like big government. It sounded technocratic. It sounded school marmory-ish to people. Well, no matter what you think of her, um, I don't know that I have a plan is the best thing. So your solution, of course, needs to have some plan baked into it, but you want to have it be a visionary solution, not so much just a technical solution. Your solution needs to be, well, it sounds like imaginary. How do we actually get there? How does this happen? Some of the things you'll talk about are incremental. Um, I want you to bear in mind that Medicare, when it was passed in 1965, was incremental. It wasn't a universal health care plan, it was incremental. Medicaid was incremental. Frankly, single payer is incremental. It's just foundational and it's important, but it doesn't solve a lot of the other problems that we need to solve. So all change is incremental, be it large or small. So if you're worried about what I'm proposing here is just incremental, remember that pretty much everything is all incremental. When I started giving my talks, the first batch of them, I would take all the questions, and then my talk after that, since they were all practices, as I said, my talk after that, I would add a chapter that addressed the question that came up from the last talk, because I thought, that's a good point. Let's talk about that. So I built in a chapter to talk about the questions that came up on the last talk. And before you knew it, I couldn't talk about single payer in under an hour and a half. And that was like really wacky. And my wife, who I'm going to come back to again a second time later, or a third time later, my wife pointed out to me that really what you want to do is have your talk be as short as possible and have most of the time be for questions because the 20 questions that came up on the last talk may not be the 20 questions that'll come up on this talk. And you don't know what's on their mind unless they get to ask it. So if they don't ask a question that you think is really important, you can ask that to them. Hey, does anybody care about what this means for jobs or whatever? So you can ask questions, yourself if it's not going where you want to, but save that. Have answers prepared for the 10 or 20 most common questions, but the more you can shorten your presentation, which is again not a skill of mine, as you know, the more you can shorten your presentation and save the obstacles and barriers for the Q&A, probably the better. And then lastly, all of your talks should have a call to action. And the sooner the better. It can be a call for something to do right now, so lift up your iPhone right now and, click on this QR code and, blah, blah, blah. So it can, so an action that's immediate is the best, or soon is good. So sooner the better, and it's a commitment that they're going to take action. So getting them to start is the most important thing. The second step is always easier than the first step. And when you're talking about calls to action, remember that you don't have to be acting every minute. It's okay for y'all to go back to school and to be learning about mitochondria or whatever the hell you're learning about next. I don't know. Probably not mitochondria. That was probably previous. But I like to think of presentation or of advocacy work as music, as choir music in particular. So there's sopranos, there's altos, tenors, and basses, which each contribute different things. And good music that goes on for a while will sometimes have mostly sopranos and altos singing. Sometimes it'll be a bass solo. And when it's the bass solo, the sopranos are resting their voices, So occasionally all four sing together. But it's okay if you're someone whose job is like writing because you like writing and you don't like speaking. It's okay to like spend a few weeks writing and then to shut up and let somebody else do talking about the writing. Don't feel like you have to be engaged on all parameters of advocacy at all times. Figure out your spot, figure out when you want to contribute and how you want to contribute, and step aside. Let the tenors take over for a while. So don't feel like everything is resting on you. So when you go from these to the others, you want to figure out how you're going to get from one to the other. And I think of those as off ramps and on ramps. Occasionally, I literally think of them like that. So I did that for you. I wanted to get to we all have comfort zones. And so I showed you the bead store. And I kind of tried to make a transition there for you. If you get a chance to listen to Rachel Maddow, she's like the queen of this. Her stories just lead from one to the next. And she's so good at it. Sometimes when you're listening to her opening story, you're thinking, I know she's going to go somewhere, but I don't know where. And so think of how you're going to do that. So for examples, you give your opening, go, so that's why Medicare for All is important to you as well as to me. I know this sounded dreadful, but not to worry. There's a solution. We know what to do about this. And if you really care, if what I said is really something you think is important, well, then here's what you can do. So think about the transitions, the off ramps and on ramps, and don't do it this way. Don't have like a series of slides that then you go, then you put up the next slide and go, oh yeah, and in this slide, what you can see is that's that's not a transition. That's you looking at slides. Prepare a little bit. Know what your next slide is going to be. Know what's going to come. As much as you can. Sometimes you'll screw that up, but try to not have the slides be the driver. Have it not be you're responding to your slides. Have it be the slides are supplementing the story arc that you're building. And then think about, I think one of you asked this a few days ago, how much time do you spend on which? And I would do it like this, have the lion's share of your time be on the back end. And PNHP, because our brand for literally for decades, appropriately so, has been doing the research and foundational studies demonstrating the platform is on fire. Our presentations historically have been 90% problem statement and maybe a touch on the solution and occasionally, if an afterthought, a call to action. And that was probably the right thing before the landscape shifted. But I'm here to tell you at this point, that's not the right thing. At this point, I told you last time, and actually Caro Rosario said, Americans have 99 problems and they're not looking for number 100. So got to say what the problems are to a bit, but emphasize solutions and what you can do. So keep your opener short and make it engaging, and think carefully about your time in this way. And I've done the arithmetic, and it turns out that the 5 minutes at the beginning of a talk, I can prove it to you, they are exactly as long as the 5 minutes at the end of a talk. No, that sounds kind of silly. But the reason I point this out is I don't know how many times I've seen somebody blow off the first 5 minutes. Well, we've got 70 people here, and I think there were 80 who registered, so we're going to wait another 5 minutes and let those other stragglers show up. No, then you've wasted those 5 minutes, and then when you get to the last 5 minutes and you're out of time, you're thinking, well, I wish I just had 5 more minutes. Well, you did, you chose not to use them, so start on time. Do your best to start on time. Now, you're not always the host, and your host really gets to drive that. But if your host isn't starting things on time, and you have any way to influence, you can kind of nudge your host and say, hey, I'm ready to go. I've got an hour's worth of material here. Can we get, so do your best. And if you own it, start on time. Start the thing on time. This is yet another idea I got from my wife. And no, she is, I do not boss her, but she came up with this phrase, boss it, is what she told me to do. So, and I love this acronym. It was really helpful to me when she gave me this feedback. She said, breathe. And this is the Obama thing. Obama would stand there when you'd ask him a question, he would look out in the horizon and he would maybe hold his hand up and he would, you know, uh, breathe. It's okay to, in between sections of your talk or at the beginning of your talk, or if somebody asks you something, or if you want to emphasize something, or you have a really important point about to come up. One technique to build drama, frankly, is to breathe. Frankly, is to breathe. So breathe. Don't go so fast that you're not able to feel it. Um, if you have a joke embedded in your slides and you're just going to blow right through the joke and get to the next stuff, make some little passing comment that's kind of ironic and funny to yourself, but and go past it. Well, if you tell a joke, it's got to land, right? They've got to hear it. They've got to get the punchline. They've got to compare it to the thing that it's not. A joke has to have a moment to land. So just adding a quick little 5-word ironic comment in the middle of a paragraph, no, that doesn't work. If you're going to say something, mean it. Say it like it's yours. Own the damn thing. Own it. So don't do any casual pieces to it. If you're going to say it, mean it. Think about your tempo. Um, for me, I need, and for frankly, my experience with most speakers is that we need to slow down. Maybe it's doctor speakers. We need to slow down. Um, the book I'm going to show you at the end from TED Talks, they actually tell most speakers they need to speed up. So my experience with physician speakers is we need to slow down. TED Talks advice is speed up. So I don't know what the right answer is, but I do know that if you write out a script, the ideal pacing for your script is about 150 words per minute. So if you have a way to pace yourself like that and write a script and think of how you're speaking, that's one way to tell whether you're going too quickly or too slowly. But generally, in my experience with physicians, we need to slow down. And then lastly, simplify. You've been studying this thing for a while because you prepared your talk, so you know this more. Don't use acronyms. Nobody knows your acronyms. Don't even assume people know what CMS is or what RUA is. Raise your hand. Do you know what an RUA is? Yeah, it's a rarely used acronym. So yeah, you don't know that. Yeah, now you do. Yeah, yeah. Okay, so that was a joke. So I'm pausing for just a moment. So simplify, right? Simplify. So I thought Emerson said this nicely. He was talking to Thoreau, and he said, "Simplify, simplify, simplify," because Emerson's stuff was just so long, and Thoreau said, one simplify would have done, Ralph. Simplify. Um, humor. Be really careful with humor. It's a very narrow target, surrounded by a moat of not funny. That was one of the things I was taught. I was also once taught to expunge all humor from my presentation, and I tried that, and I can't. Oh, granted, my jokes aren't funny. I'm not pretending that they are, but there are things that make me think are that I think are funny. And I did once try to expunge all of my humor, and I can't do that. So I'm not telling you don't. I'm not telling you to expunge that. But I am telling you to think really carefully. And for crying out loud, don't be inappropriate with your humor. But just remember, humor is really hard target to hit. So be yourself. Try not to say things you don't believe. Say what you do believe. It doesn't matter if you like to stand still or if you like to walk around. There have been studies of educational effectiveness of people who stand quite still behind their stage or people who walk up and down the lecture hall. Have a lavalier like if you're going to do that or something. But it doesn't matter. That doesn't change. It's move if you want to. But don't do this. Don't do this. Don't if you watch yourself and you find that you've got this mannerism, if you do this, I swear to God, what I'm going to do is I'm going to time that and I'm going to start trying to do the arithmetic about what the periodicity of your rock means for how tall you are, because there are sort of ways to calculate this. Don't do that. If you have a mannerism, that's distracting and bad. But if you want to move around, that's perfectly fine. Um, you want to dress comfortably. You want to dress at the level you think your crowd is going to be, or one level higher. It's okay to dress one level higher. You don't want to dress a level or two below in general. And I can tell you anecdotes about where I got that wrong, but I will not. But remember that your clothing is a covert signal for which tribe you're in. And I gave you a talk before showing that tribalism is really important. You don't want to dress in a way that immediately identifies you as other. So you've got enough challenges with that. So try to dress in a way that's concordant with whom you think is who you're trying to reach. And move if you want to, but only if you want to. No, it's on there twice. God, how about that? So yeah, no rocking or swaying. Stay on message. If you're somebody like a friend of mine who's really into Harry Truman, I mean, like he knows, what day Harry Truman had his first ribs at a barbecue. I mean, he knows everything about Harry Truman. So it's really easy for him to wander off of topic into a Harry Truman anecdote that's got really nothing to do with stuff. Anecdotes are great, for all the reasons that I kind of alluded to, but if you're going to do that, if you're going to wander off of your message, think about whether whether that anecdote adds to or distracts from what you're trying to say. You will have other rodeos, so stay on message as much as you can. And, people have to hear you. you can speak quietly, and, if you are, kind of test that with your microphone on Zoom. I think y'all can still hear me, but you've been in things, sometimes that really gets people's attention if you're a quiet speaker, but it's loud enough for people to hear, that's okay. But if you're in a room, if you're in person, don't use that quiet voice that they can't hear, speak. And so if you tell people this, they'll often start doing that for the first 2 or 3 minutes, and within 2 or 3 minutes, they will forget that. So if you're somebody who's inclined to speak too quietly, find a way to remind yourself. Maybe make a little placard that says outdoor voice that you just put in front of your computer when you're speaking or whatever. Some way to remind yourself that people in the back row, or train yourself to be thinking about the person in the back row. Use your outdoor voice. Buckminster Fuller, I don't know if you know him. He was quite a visionist, a fusionary. He's the guy who created tetrahedral domes, or geodesic domes. Anyway, I saw him speak in the 1960s, and this is a really ironic statement about him because he showed up in the 1960s on a college campus, white shirt, black suit, thin black tie. And one of the things he said, actually the only thing I remember that he said, was somebody asked him why he's dressed like that. And he said he wanted to be remembered for his content and ideas and not for his clothes. So he tried to dress very conservatively. So he completely blew that, because the only thing I remember from him from that talk in the 1960s was, or 70s, I guess it was his clothing choice. So you don't want to have like this something garish or something outlandish that really they're going to really want to see what that is. That's, you don't want to be remembered for being the only person dressed like that. In general, I mean, if that's your brand, make that, own it. Pronouns. And so pronouns, there's a lot of implications to pronouns, especially gender-wise right now, and that's important and something well worth respecting. This is a different part of that I want to go through. Pronouns are something that we tend to take for granted, but they're really important. First person singular pronouns. I can't tell you how many times I've been tricked by a salesperson using a first person singular pronoun. Had a person sell me an HVAC system for my house. They came to our house. We were putting in a system that needed evacuation, needed exhaust hoods and stuff for my wife's glass studio. And the salesperson said, so I'm going to put this over here, and I'm going to put that over there, and I'm going to put this kind of thing. And it's like first person singular pronouns the whole time. And I thought he must be the owner. I didn't ask him, but then we signed the contract and I never saw him again. He was just the salesperson. Really compelling. First person singular, really compelling, implies ownership. If he had been saying, so we're going to do this and we're going to do that, I would have been thinking, well, who's actually going to be designing the HVAC? What do you mean we? Who is that? So if you say, I have found this, then that's kind of implying in your practice. If you say, we have found this, that's sort of interesting. Who's the we? Maybe you want to cite the journal. Well, here's something from, such and so, the Zachary Daniels researchers at the University of yada yada found that, so be clear. We is kind of confusing. It still has ownership. You're in the we, but it's nowhere near as strong. Second person pronouns. Huge, underused amongst healthcare advocates. Second person pronouns. Rush Limbaugh was a master of this, and you're welcome. I forced myself to spend 6 months listening to Rush Limbaugh for as long as I could take it, twice a week on the radio, which turned out to be about 5 minutes. As much as I can think he contributed terribly to democracy, he was a highly skilled and intelligent speaker. And he was a master of these second person pronouns. So he would say things on the radio. You're in your car all by yourself, right? And you're listening to this, empty voice on the radio saying, well, you know this. Then he would pause. And the person in the car would be thinking, what is it that I know? He would say, because you're a smart listener. You know this. You know that such and such. And then the smart listener would think, yeah, I am a smart listener. I did know that. So second person pronouns are very engaging, almost to the point of being manipulative. All y'all is a phrase very commonly used around here in Missouri. Y'all is singular and all y'all is the plural of y'all. I don't know if you know that. I'm from Chicago, so I had to actually learn that when I moved to Missouri, but all y'all, it's a tribal clue. So be thoughtful if you're going to use all y'all or just y'all. It's rare that somebody outside of the South will actually use this. I completely support, respecting this when you need to, but also recognize that they implies other. They implies them. So, use this carefully. Here's somebody who uses it very thoughtfully. So he said, they want to control what you do. They want to destroy you. They want to destroy your way of life. You framing is a tool commonly used by populist or authoritarians to create emotional connections with their followers. So think about that. If maybe you want to use that, maybe when you're talking about corporations, you can put them into the third person plural. They do this to you. They do this to you. So I'm just saying, be thoughtful about which pronouns. Some have more power and imply things you weren't quite ready or really expecting for. So be really ready. I don't know. Some people assume you know how to get around their campus. Um, I kind of have a dread when I'm invited to go speak at a university campus because, I mean, I've been on campuses where there's three buildings with the same damn name, and and good luck finding it. So make really sure you know where you're going and make sure that anybody who invited you understands the complex science behind time zones. It seems to be a lost art to understand that. And make sure that that the time didn't change. You want to check that the time is right, even the day before. Make sure you've got that. If it's a link, make sure that the link hasn't changed. Make sure there was just one link. Really do your best to validate that you've got the whole thing. You've got the whole thing right. If you're going in person, bring stuff. So if you're going in person, for sure, bring your own laptop and don't rely on your laptop's battery. Bring cords, bring whatever adapters you might need. I've got a whole package of C and A and, all kinds of fancy adapters, every kind of adapter you can want in my little package that travels with. Have your remote advancer of your own that you're comfortable with, you're familiar with. Nowadays, they plug into anything. Most remote advancers include a laser. Do not use the laser. If you're using the laser during your presentation, that's proof positive that your slides are crummy. Your slides, you can draw a circle on your slide. Remember that guy I showed sleeping? I drew a circle around him. I didn't have to find my cursor and point to. I drew a circle around him. So make your slides stand out, highlight what you're saying. If you're using the laser, you're already your slides are screwed up. So don't use the laser ever ever. There's no situation where you should be using the laser. Um, I actually travel with my own when I'm going to in-person gigs. If I'm driving, I have my own projector because you can't believe people. I bring my own screen. I have a large screen that fits into the back of my car. I didn't used to do that, but I learned so many times. I went to some presentation in rural Missouri down in about 3 hours from here. And fortunately, I had been packing my stuff because I didn't trust anybody by that point. And my host said, "Oh, not to worry. We got a big screen. We're bringing this big screen. They'll see you from the back of the gymnasium because it's in a gymnasium. We're bringing all that. Not to worry." Well, his idea of a big screen was a big screen like for your TV. It was about a 20-inch diameter or cross section TV screen monitor that he put up. Look at that big screen. Nobody outside the first 10 people would be able to see it. So if they say they've got a big screen, ask them what that means. If they say, "Oh no, we can show your slides on the wall," ask them what the wall's like. It's probably painted green or something. So, I mean, worst case, bring a sheet that you can tape to the wall, a white sheet that you can tape to the wall. But ideally, just travel with your own screen. It's just safer if you can. If somebody says they've got a screen, really dig into what the dimensions are before you trust them. I went to a presentation that a pastor invited me to, and he was a young person, and he said, "Oh yeah, yeah, we as long as your laptop has a USB port, we can connect you to our system, and it'll be just great, a great sound system, big screen we use behind the, great, So okay, again, I didn't trust him, even though he was a pastor, and so I showed up with all my equipment in my car, and I went to give the talk, and go into the room, and there's no screen, there's no place to plug in. There's nothing of the sort. I said, "Where's the screen?" He said, "Oh, that's in the other room that this other group has today. We're down here. Do you have a screen?" A pastor did that to me. So, don't believe anybody. And that's not maliciousness. I mean, he was a great guy. It was just you know, bring your own equipment if at all possible. Bring your own equipment if at all possible. I was someplace where the only power source, it was a Grange Hall. I don't know if you know Grange Halls, but it was a Grange Hall in Michigan, rural Michigan, and the only outlet was at I'll bet 70 feet away at the back of the room, and I was at the front of the room, and there was no way to turn me around. disaster waiting, and I didn't. Somebody had to run to his farm and get a long extension cord. So now I travel with a 100-foot extension cord and have multiple plugs. Have the 3-to-2 adapters. Have it be able to plug in if you're using speaker. Have more than one place you can plug in. So I've got this very nice extension cord, 100 feet long, and it's got a triple head on it, so you can do whatever you need to do. Um, don't even bring the laser pointer. If you can, burn the hole out of it, just don't bring it. And then have all the kind of supportive stuff. Everything breaks down, everything breaks down. It's not astonishing to get there and discover that your laptop's on the fritz. So have a thumb drive backup copy of your slides if you need to. Email your slides to yourself or to somebody so you can have somebody else, download it onto their laptop. If you need to, maybe have a printed copy so you can at least walk through it or print an outline or something. Have a backup plan for if all your systems fail. Bring your own timing equipment. Don't bring a library. I've seen a lot of people go to these things and we've got, like 30 different handouts, 20 articles that we've printed, and then, an explanation on red paper and an explanation on green paper and an explanation. So they'll set up a table with 30 different handouts, and it's like a library or a bookstore. And then some people will diligently come in and they'll pick up every one of these things because they think they're supposed to. And then they'll take them home, and no one ever reads that. No one ever reads that. So if you bring 30 handouts, that's you declaring that you don't know how to prioritize the materials you have. Bring one handout, maybe two, that has really the key messages, and have links on it, QR codes or something. Have 1 or 2 handouts at the most. And if you do bring handouts, own them. Own them in some way. Have there be a link or identification of your name or your organization's name or some way for them to reach you. Have your name or your organization's name on anything paper that gets left behind and shared. Own that. If you have sign up, if you want people to sign up, the best way is to use email. You have Sheets, Clipboard. So when I'm doing in-person things, if I can, what I try to do is have 3 or 4 clipboards that people can sign their name to. I don't put those at the entry, at the doorway coming in, because then it creates a bottleneck. I don't put them at the doorway going out because everybody wants to hurry out. So what I try to do is figure out a time about a half or 2/3 of the way through I talk, and then I'll declare, I'm going to take a pause for a minute because if you like this and you want to hear more of this kind of thing, I really want to be able to stay in touch with you. And so I've got these sign-up sheets, and then have your host, because they've got value to the group. The host is a trusted person at that point. So have your host, not a random person, but your host, have the 3 handouts and pass them or clipboards with a pen, and have them strategically hand the clipboard to people roughly equidistant scattered around the room, so that then you can get the whole room to fill out their stuff beforehand. And have somebody prime the pump. Have somebody, before you pass out the sheets, before the room even assembles, have somebody fill in their name and their contact information first. If you don't, I promise you, they will leave big blanks. But if the first person actually has the information that you want, like their zip code or their phone number and their email, have all those buckets filled, then the next person will see, oh, that's the modeled behavior that we're getting. So have an email sheet started. Have every one of those email sheets started. And have business cards. They're so cheap. They're so cheap. Have business cards printed up with your name, and it can say Snap on it. Use the Snap logo, or what have you. Get those printed up, so that with contact information. Not that you're going to fling them around, but you'll be having a conversation with somebody, and they'll say, so how do I reach you? And you can hand them a business card, or phone links or whatever you want to do. This part was probably kind of detailed and boring, but don't worry, you won't remember this conversation. This is in the middle. This is in the dead zone. You won't remember that we talked about this. So good for that. So the day of the event, think about yourself, manage yourself. Don't think, nervous about this talk. I need to be smarter. I've read that caffeine can raise your IQ. I'm going to have a little extra caffeine. No, don't do that. And don't skip your caffeine. Be, what's the word? Eucaffeinic? Be pharmacologic. Be your normal self. Be as caffeinated or uncaffeinated as you ordinarily are. I went to one talk and I had this terrible cold. This is pre-COVID. Now I just wouldn't go, of course, but I took unwittingly 240 milligrams long acting of pseudoephedrine. And that was when I learned not to use laser pointers because I was taking the laser pointer and I was all around the room. So don't take, if you don't usually take pseudoephedrine every day, don't take pseudoephedrine right before or anything right before you talk. Um, don't show up at the last minute. On Zoom, not even at the last minute. On Zoom, you want to get there at least 10 minutes ahead to check any technical problems. But in person, get there at least 30 minutes ahead, ideally an hour ahead. If you're in some room that you're very familiar with, 30 minutes is probably plenty. But get everything set up. Get your computer set up, get your everything set up, check your slides, make sure your remote thing's working from where in the room you're going to talk, get all that stuff up, and then you can relax. And by relaxing, I mean a few things, but one thing I mean is 5 minutes before you go talk, before you're ready to start, excuse yourself and go to the bathroom. Of course, pee if you gotta pee, but go there no matter what, so you can have nobody around you for a couple minutes and you can, center yourself and breathe and kind of calm down and have it fresh in your head. Um, but most of the time, after you've gotten there and you're set up, you want to act like you're at a dinner party that you invited people to and you're the host at. So mingle, walk around to them, and listen, introduce yourself, but ask them like, so why did you decide to come here? What are you hoping to get? And then shut up and listen. I did this once. I do that a lot. And I did this once, and the answer I got was, "Yeah, I really want to hear what Tim has to say," because there were two speakers, and I was number two, and Tim was number one, and he had like zero interest in me. He wanted to hear the other guy. So that kind of taught me, I've got a little bit of an uphill struggle here. It turns out Tim was awesome, but listen, you might be surprised. And they might say something that then you can use to kind of guide how you're talking. Remember that you're going to talk about others. You're going to be invited back if you're good, and stay on message. And then think about how the room is set up. On Zoom, that's a different thing. But in person, think about your space. So I play ukulele, and I was at a little jam session, or what we call it. And here's a picture I took of how the room was set up. It was at an American Legion's hall, and there were these, conference tables, and we were all sitting like this. And I promise you, the person at the far end could not hear the leader at the front end. And people were actually saying things like, "Geez, we can't hear. Why couldn't you speak up? Speak up. Play. How ridiculous." Here's how the tables were laid out, and we could have done this. There's no reason we couldn't have done that. So, do that. When you go into a room and it's temporary tables, rearrange the rooms. But if you're going to if you're a guest, you want to be sure you can put the tables back the way they were when you came in. So think about how the tables are laid out when you walk in, and if it's not the way you want them laid out, move them. And if your host is actually there, of course, ask them if it's okay. But yeah, take a picture and try to make sure that you can get it back as close to original as you can. You want to be a good guest. You don't want the host to think that they have to do extra work. So here's another thing about how the room is laid out. This is David Ball. He's a single-payer advocate in North Carolina. He's moved now. He's not there anymore. But here's a picture of him speaking, and I want to point out to you where he's standing. He's standing in the middle of the room. So he was set up to be standing here behind the podium. So this is the screen is at the top, the podium is on the left, and then the projector in the middle, and all these seats arranged like a classroom. So this is the least interactive way to set things up. And maybe that's okay. Maybe, got 300 people in the room, there ain't going to be no interactions. Maybe that's okay. But look at what he did. He didn't do that. He took that and he moved himself. Oh, I'm not showing it, but he got rid of the podium and he moved himself down to in front. This is also an annoying way that smaller rooms are often set up. So there you are at the foot, and there's the screen at the opposite. My nickname for this is Torticollis de PowerPoint. People don't know, should we look at him? Should we look at the slides? Or should we look at him? Or should we? So if you're live and the room is set up like this, that's like awful. And it doesn't have to be like that. If nothing else, move yourself there. Move yourself there. And then it's not quite as dreadful. And ideally, you would even get rid of those two chairs because they're kind of struggling. So So when you walk into the room, think about how it's set up, think about where the chairs are, and do your best to have yourself and your slides be the focus. Or if you're really about trying to get group interaction, you want them all kind of talking with each other, you really want that happening, arrange it so you can get into the center of the room, and now automatically the people all around the room are kind of looking at each other. So that maximizes introductions. You might not want introductions max or interactions maximized, so only do this if you actually do. So think about your opening notes, try to make eye contact. If you can't make eye contact, if you're not comfortable, stare at somebody's forehead from a distance. They can't see the difference. Um, if you find that people aren't listening to you and you're ready to start, I've found I was taught sometimes just start speaking. They're all talking until they hear you talk. So sometimes if they're not listening to you, you can, tap on the thing, try to get their attention. But if it's not working, just launch into your material. Of course, have it not be core material, but launch into it. Um, talk loudly sometimes and pace it, slow down and stuff. I know somebody who uses pauses really effectively. He's very effective. He's very effective. He's very effective. He's very effective. So that's a way to kind of get people to hear what you're saying sometimes. Does anybody know what an APM is? It's like an RUA, but it's not. APM is actualies per minute. This is a direct quote from a speaker at Express Scripts one day who said this, and he said, actually, I actually find that this is actually an important point, actually. He said the word actually so many times. I began to, when I was listening to him, because we were all sort of critiquing each other, I would listen to him and I counted how many actuallys he said in his 10-minute talk and then divided it by 10. And I gave him a score, his APMs, his actuallys per minute. And I told him, you're good job. Your APM was down to 2. It was up to 10 when we started. So, and of course he was offended. What I would tell you is to not be offended if somebody points out a mannerism to you, not be offended. Say, thank you. I didn't realize I was doing that. I realize that that's distracting. It's not a good thing, but what do you do about it? What do you do about it? How do you break yourself out of the habit? Burn it out. So what you can do if you're doing this actually is actually to actually use actually, the actually, word actually, every actually, other actually, word actually, in actually, your actually, sentences actually, for actually, burn it out. Don't do it in public like I just did. Make yourself spend 3 minutes, 5 minutes every day for a week burning out the word that you are overusing. And I promise you, after a week of that, you will never use that word, overuse that word again. So if you realize you're doing that, overkill it, burn it out, and that will work. So remember that you have to manage their expectations. I think we kind of did this. Yeah, so we're going to skip that. Okay, good. That takes us right on time to the elevator speech practice session. So let me tell you what I want you to do. Pretend you're in this elevator. Very uncomfortable. If you look up Google most uncomfortable elevator ride, you'll find Luke Skywalker and Darth Vader when they were riding to see Emperor Palpatine. So hopefully you won't be in quite that bad of a situation. So what I want you to try to do is think on, you've heard what single payer is, you know that, you know some of the other issues, you've heard how to message to different audiences, you've heard how to build a talk, you know all of that stuff. So imagine you're in an elevator with somebody who has, somebody whom you want to have influence on. It might be a complete stranger, you don't know them, might be you're in the elevator with Ted Cruz, might be you're in the elevator with Pramila Jayapal, it might be that you're in the elevator with a staff aide, it might be in the elevator with the chief of staff at your hospital, with the guy who owns Wendy's, or somebody you have no idea. So think about that. Pick your audience. Decide, in your breakout group, decide to whom you want to be stumbling into in the elevator. So decide to whom you're speaking. Have a fairly clear vision of whom you're speaking to, and when you get back together, tell us to whom you're speaking. Pick one topic. It's an elevator talk. You can't kind of unpack the entire rodeo. It's an elevator topic. So talk. You're only going to have 1 minute. So pick one thing. You're going to want to talk about Medicare saves money. Medicare saves lives. Medicare Advantage is hurting people. Medicaid is, the big bad bill is not a big good bill. I don't care what topic you pick. Pick a topic, but one topic with really just one message. And you're going to be in, how many of us are there? There's, how many of you are there? 10, I think.
9 today.
10, yeah. Okay, so we're going to break up into three groups. And most groups will have three people in them. Pick one topic for one speaker, and that's going to be the speaker when we get back together. And then the three or four of you construct a 1 minute talk that the speaker will give. We will reconvene at the end of the breakout group, and the stop sharing, and the speaker will speak for 1 minute, and I will time you for 1 minute, and I will actually interrupt you at the 1 minute mark. So, because I am rude, so we will do that, and then the people from the group who knew what the speaker was supposed to be saying will critique it, and then the rest of us will critique it. And this is we will stop recording when we get into the breakout groups. We will not record during the critiques, but then if you can, I'd like you to resume the recording after the critiques, because the last 10 minutes or so of content, I think, are something I'd like that guy that wants to see it. I'd like him to see that part too. So we will stop recording, which means you can be frank with your classmates. By now, you all know each other a bit. You all know that you each bring incredible value to this conversation and dialogue, which means that if you have something critical to say that's constructive, that's good. So be critical in that feedback. So y'all know what the assignment is. And I believe we have a total of until we have 50 minutes left. Let's say I want to have 20 minutes for the back end, probably 10 for what I'm saying, and then 10 for whatever you want to bring up after that. So we want to be done with the critiques by the top of the hour, which means we want to have, let's say, 10 minutes, 15 minutes for the talk, the breakout, for you to say your spiel. So let's have the breakout groups go for how about 15 minutes? It should be enough time. Let's plan that for 15 minutes, and then we will reconvene. A couple of them out too. Good job on the recording management. Well above my skill level. Okay, so I wanted to talk a little bit about slides, because as you probably know, I'm a PowerPoint addict, junkie. So I wanted to talk a little bit about that. And then I wanted to talk a little bit about sort of where to speak and give you another resource. And then we'll hopefully have a little bit of time to chat. So slides. Here's my most important message. PowerPoint is not Word. I kind of alluded to that when I talked about the person who just sort of read every word on what was a Word document that he had turned into PowerPoint. So think about how you use them differently. So PowerPoint, you want to avoid having more than 6 lines plus the headline, but more than 6 lines at the most on it. You can have footnotes, on the reference at the bottom of the slides, but the content of the slides, 6 lines should be the most. You want to try to use 28-point fonts or larger. You can go as small as 20. You don't want to go to 18 or 16. But 28-point should be your working minimum. Here's 20-point. You can still read that, right? But it gets harder the smaller it gets. On PowerPoint, you want to avoid serifs. You know what serifs are? They're those little things at the end. So everything above that sentence that avoids serifs is a sans serif, sans meaning without, and serif meaning angel wing. So the fonts are divided into two broad groups: sans serif, like Arial and Helvetica, and then serif fonts, like Times New Roman. So those little serifs have been designed to make your eye move more quickly across large blocks of text. That's why they're there. And actually, reading studies confirm that a book or a paragraph that's got serifs in the font, you can read more quickly than without. That's why they were invented. That's what they do. It's great. In PowerPoint, they just look a little bit fuzzy or blurry, and you're not going to have so much text that you have to accelerate speeding time. They just look ancient. They don't look right. So they don't help, and they kind of hurt a little bit. So if you're doing PowerPoint slides, try to have most of your text be in a sans serif font. And hooray, do you see any sentences on this slide? There's no sentences. You don't have to have sentences. You don't have to have verbs. You don't have to have grammar correct. And understand me, I am a grammar Nazi. I am like, I read grammar books. I read rhetoric books. I go to grammar-centric movies and present. I love grammar rules. Forget all that when you're making slides. You want to just have grammar freedom. There's no sentence there. Grammar freedom. I, if anybody calls you on that, you can say Dr. Ed Weisbart on July 7th, 2025 gave me license to break all grammar rules. So there you go, grammar freedom. But there are exceptions to this. This is when you, if you're speaking to a legislative body, if you're speaking to an investment body, those are the two main exceptions. On those bodies, you want to have absolutely zero room for ambiguity on your slides, or any situation where the slides are all that's going to be left, and they'll be sharing the slides and they won't know what your talking points were. So occasionally, if you're talking to a legislative body or an investment firm, you want to no, you want to use grammar rules. You want to have sentences. You want to leave little room for ambiguity in what you're saying. But otherwise, just think of it as a cartoon to help you kind of talk through the things that you want to talk. A nudge to you, a thing for your audience. So pretty important. Word, on the other hand, paragraphs, right? Not paragraphs on PowerPoint, not books on PowerPoint. Handouts should be in a serif font in Word in general. So there's that. Where do you speak? Um, so the speaking opportunities come from easy to hard, and I recommend you start at easy and develop to hard. So easiest, of course, would be an audience that would be inclined to be supportive. So that would be your friends, right? So one of the first thing, if you get a talk together that you want to give, be it a 3-minute talk or a 20-minute talk or an hour talk, have three, four, maybe 10, probably not 10, three, four, six, seven of your friends over to your house and tell them, hey, I've done this thing. I want to kind of try it out. I want you to give me criticism. I want you to be constructive, but I do want you to tell me where you lost me. I want to kind of see where your eyes are rolling over. I want you to help me get better, and I want to test that out on you. Most of your friends will be flattered and appreciative of the fact that you want their opinion. So first thing to do, get your talk together and try it out on your friends. Faith-based groups tend to be pretty supportive of what we're trying to do. So church basements are great places in general to do these things. Groups of social workers, if you have access to them, they tend to be right on board and they tend to be supportive. It's sort of like in their career path is to be supportive. Nursing groups, the National Nurses Union is like all about single payer. Nurses in general are about this. Teachers tend to be pretty supportive of where we're going. Med students, notice that I'm kind of working up to increasingly difficult groups. You might want to do your first talk to a bunch of med students. You might, but there's pretty, as if you're talking to SNAP members, it's relatively easy. But if you're talking to your whole med school class, I promise you there's going to be some folks who have very divergent points of view from you, and they're used to being very type A personalities and dominating the conversation. So might be really supportive, but your class, and you might find it's more uncomfortable than you at first. So you want to get a little bit of confidence and experience under your belt. If you do run into somebody combative there, you want to, not take them on as an argument, but listen to what they're saying. And if you don't know the answer, to say, well, I'm going to think about that. Thanks for bringing that up. And, next time we meet, we'll have more. But I would say med students are still in general in the supportive first tier, but don't just assume that that's going to be an easy peasy thing. These groups tend to be, why haven't you done this already? Kind of groups. So they're easy to talk to. They'll often want to have a physician. And if you're worried that that's not your political allegiance, frankly, those are not my political allegiances, and yet I speak to them whenever I can. And I try desperately to get into Republican parties, but I haven't gotten through just yet. But you can speak to any political body that you want to. Just be clear that you're not endorsing them as a part of SNAP. Some groups that can be more surprising, so kind of do your research and know with whom you're speaking. Democratic clubs, you would think that would be easy peasy, but the Democratic Party is clearly not 100% aligned with where we're trying to go. So, and if you've seen one Democratic Party, you've seen one Democratic Party. So they all have their local community meetings, and if you're going to go speak to one, try to get a lay of the land before you go hog wild into that blindly. So, in particular, know who the host is and ask the host what they can tell you about what to expect. Retirees in general are supportive of where we're going, but retirees sometimes view Medicare for All as a I've got Medicare. If you let everybody into it, then my waiting time is going to go up, so I'm not so sure I want that, and you're going to take away. So the retirees may or may not be comfortable with this, um, and and now we know, majority of retirees have Medicare Advantage. So, be respectful of the fact if you're there giving criticisms of Medicare Advantage, as I do all the time, of course, be respectful of the fact that people who can't afford Medigap are frankly trapped in Medicare Advantage, and don't make them feel guilty about it. Don't make them feel bad about it. They may have made the best decision that they could, given their resources. But point things out as best you can. So, but retirees usually are good audiences to talk to. If you go to specialty sort of groups, in this order, I would say you find support starting high and then not being as high. So be thoughtful. Some primary care groups are really on board with this, and some are more suspect. Just, be thoughtful. If you get a chance to talk to a psych group or a peds group, in my experience, those are the easiest. Hospital staffs are like all over the place. Laborers and unions, sometimes they're supportive and sometimes they're not. So do your homework and don't start in this bucket. Don't start with the surgeons or the radiologists or anesthesiologists. You should know that surveys show that on average, 60% of docs agree with you with us on single payer stuff. That's as high as about 80% in psychiatry, and it's as low as about 30 or 35% in surgery and anesthesia and radiology. So it's not zero, but they are generally more critical and worried, of course, about income protection. And they have less exposure to ongoing relationships with patients, repeating and repeating and repeating the problems that they've had. So they don't necessarily see it quite as much as people in psychiatry hear all the time. So um, don't shy away, but don't start with those groups. Medical associations, again, can be all over the place. These groups I find are the most fun. That's my favorite kind of group to talk to. They start by taking a very conservative point of view in general, but they aren't like rigidly locked on to disagreeing with you. So I find that I can have really less emotional, thoughtful, informative discussions in these groups, and I really like them. But be sure you know what you're getting into with that. And then this is for me the holy grail that I've not yet achieved, despite having done several cold call and outreach. Then the very last thing I want to do is to tell you about this fantastic book if you want to learn how to be a better speaker. The TED people, the official TED Talks people, have a book about how to speak in public, and there's a whole bunch of stuff. It's a relatively thin book. It's a relatively big font. It's from the TED Talks people, so it's readable. It's easy to get through. I really recommend this book. You can read it in portions. It's a good book to read when you're busy. And I'll just give you one takeaway from them that they said, this is just a quote, they said their number one advice to speakers: make regular eye contact with members of the audience, be warm, be real, be you, unless you're arrogant and self-centered, and then pretend to be someone else. They actually said that.